Okay, I think we are online now. Hi, everyone. Good morning, good evening to all of you who are joining us today in our session on COVID-19 digital vaccination passports and their risk on human rights. My name is Marwa Fatafta, and I'm the MENA Policy Manager at Access Now. The session will be for 45 minutes, held in English language, and I'm pleased to be joined today by friends and colleagues, Ghinwa Hayek, who is a non-resident fellow at TIMEP, the Tahrir Institute for Middle East Policy, focusing on COVID-19, public health, and access to data and information in the MENA region. She works mainly in the fields of maternal and newborn health, mental health, and now on COVID-19 in the academic and humanitarian sector in Lebanon and the Middle East. We're also joined by my colleague Veronica Arroyo, who is a Latin America policy analyst and digital ID policy lead at Access Now. To set the scene, before we get into our discussion, as the global COVID-19 vaccine is rolling out, governments in the MENA region and beyond are fastly adopting digital vaccine passports or certificates, with the aim to record and authenticate a person's vaccination status. Current proposals, however, threaten human rights by creating space for exclusion and discrimination to flourish, posing serious long-term threats to the privacy and security of millions of people across the globe. So in this session, we will explore in depth what these human risks are and discuss as well ways we can, as civil society organizations, researchers, and activists, respond to the unfolding techno-solutionism that the COVID-19 pandemic has exacerbated. I will start with Ghinwa for our discussion. Actually, before I start with Ghinwa, I just wanted to note that we aim to keep this session as interactive as possible. So please feel free to drop your questions and comments throughout the session in the chat box, and we'll make sure that we answer as many questions as we can if the time serves us. So going to you, Ghinwa. Public health authorities have many years of experience issuing vaccine certificates and maintaining vaccine record-keeping systems in non-digitized form. So digital vaccines, passports, or certificates are not new. Yet, many governments have insisted this round upon the need for a digitized response to the COVID-19 vaccination distribution. And as an epidemiologist, can you explain for a starter to the audience what are the standard vaccination certificates and what is new about the COVID-19 vaccine passports? Over to you, Redma.
Yes, thank you, Marwa. Hi, everyone. Very happy to be here, and thank you for the introduction and for the question, Marwa. So I think everyone would remember that when we were young, we would go to our pediatrician and get vaccination that many of us did not like because we were scared maybe of needles or did not, like our doctors. And obviously, maybe we don't remember, or we remember because as we grew up, we noticed that we had to use like this piece of paper. For most of us in the Arab countries, it's not an let's say, interface. So we have this paper where it's written which vaccine we took, which date, and the name of the doctor. So basically, all of us somehow do have a vaccine passport. However, this vaccine passport was kind of, let's say, more at ease because we know in each country what are the mandatory vaccines to do, and they are easily reachable for all of us. We could go to our pediatrician or to the primary healthcare center or to the hospital, depending on the healthcare system in each country, get the vaccine either for a fee or for free for in most countries. And it was never a hurdle. And then when we needed to travel to other countries, probably most of us remember needing to get other vaccines to be able to travel to the country. However, these vaccines, again, are accessible and are present in the country or where we need to, and we know how to go and get them. This is perhaps not the case with the COVID-19 vaccine, and this is the stake of this issue and the core of the problem, if I want to say. The vaccination passport, the concept of it is not something new. It goes back to the 19th century where it started with the cholera pandemic. But back then, the good thing about it is that it was used as, was started with the French, so passeport sanitaire, So it was used to tell that the person didn't have any symptoms and didn't need to go and quarantine themselves during this period. So it was for this, and not to show that the person got the vaccine, yes or no. But again, with the development of science and the development of the pandemics as we go on and their propagation in the world, we had developed this vaccine. And coming here to the COVID-19 vaccine and mostly being promoted as a tech solution or as an application that we have. And again, as I said, this is a problem, and this is an ongoing debate that it has been happening in different fields, and not only perhaps in a field that's more towards digital right, but as well among scientists and epidemiologists and public health professionals, because this solution, while it is good and it protects us, it also offers, it has a disadvantage that it is, it sets back for it's a setback for marginalized populations and vulnerable population in many ways. And basically, this has a way in terms of accessing the vaccines, the availability of the vaccines, and this is not only applicable to our region. This is as well applicable to developed countries. In the United States and Canada, they do have these problems where the COVID-19 vaccination card is also a problem for marginalized populations. And perhaps later on in our talk, we're going to be discussing how this is a setback for them and disadvantage and a discrimination against these populations.
Thank you very much, Ghinwa. And one thing that stands out indeed is the issue of tying the issue of the digital vaccine passport to the accessibility of this vaccine and its distribution across the globe. And that's a great segue to Veronica. As we know that COVID-19 has imposed the highest toll on individuals and communities who have been long marginalized and underserved, so affecting their exposure to the disease, access to adequate healthcare, physical and mental well-being during lockdowns, economic stability, access to education, access to health, and much more. And so do digital vaccine certificates or passports mitigate these harms as their proponents claim, or do they exacerbate the risk of exclusion and discrimination?
Thank you, Marwa. Hi, everyone, for this. Thank you for the question, and hi, everyone, and obviously welcome to everyone who's here. That's a very, very interesting question, and what Ghinwa has already mentioned around the accessibility of the vaccines is something that we should be paying attention to. The issue in the MENA region, just to put some context, is that it's a very unequal access. There are some countries where now the rate of vaccination is quite high, while there are other countries where it's not that high at all. So we cannot say like everyone is getting their vaccines at the same speed, which obviously creates problems and more things. Just to start to say this very clearly, that at least Access now believes that this the idea of getting the vaccine and going there, it's something that we should aim for. We are in the middle of a pandemic, and it's part of, we're not encouraging people not to do it. On the contrary, we will love people to go and get the vaccination. But what we want to put some highlight on is on the ways that we are creating or using technology around this process. So mainly on what happens with digital COVID-19 vaccine certificates. Those are applications that Ghinwa mentioned. Those might be QR codes that you download, or maybe you use it. But the problems here can arise in two scenarios, to be clear. First of all, we know that technology cannot magically solve all the problems that Marwa has already mentioned. So inequality in our countries, problems to access to health services, marginalized communities will not disappear because we have a technology in our hands. This is something that we have already seen with other applications and other technologies that were implemented during this pandemic. So that's just to have that on the ground. Where we divide them, as I'm saying, there are like two spaces, and one is on international level and one is on a local level or internal level in our countries. there has been a lot of discussion regarding COVID passports or COVID-19 passport, which is the same issue. So you have an application, an app in your cell phone with all your information regarding COVID-19, specifically in this case regarding your vaccination status, that will allow you to travel from one country to the other. What happens in the region, in the MENA region, if something like this is in place? As I'm saying, there is inequality. It's not equal, the rates of vaccination. Access to vaccination is not the same in every country. So we're going to be excluding people who cannot access the vaccine easily. So these people will not be able to travel as it could have happened before, or with less restrictions, because if there is no vaccine, at least if we go back 1 year, like what happened in 2020, like traveling was restricted, yes, but there were ways to do it with other alternatives, like a COVID-19 test or any other alternatives. But today, if they are just requiring a COVID passport, in this case, this person will need to first look for the vaccine. Maybe it will be difficult to get it, and second, get something like an app. And maybe this person do not have even a cell phone, or maybe do not have internet connection, or maybe other things. That's on an international level. On a local level, because this is something that also is important in the MENA region, because there are countries who has a very high rate of vaccination. What happens in those countries? Because nowadays there are proponents, and some countries are making them mandatory, all the vaccination process and getting the vaccine. So what happens there? The issue inside the country is not regarding the accessibility of the vaccine, because it's the idea is that if it's making them mandatory, we will think that at some point every person will get the vaccine. The problem is when you make the app or the digital version of your vaccine mandatory. So you make this instrument or this tool or this document, the digital document, mandatory, because our countries are not tech savvy. They're not 100% digitalized. This is first. So there will be people, and sadly these people are in the marginalized groups, who won't have access to the technology, who won't understand how technology works, won't have reliable internet connection to have a digital passport there in their hands to show every single moment. Nor the people who will control if this happens or not will have a system to control, like, hey, yes, you have a passport, please come inside or not. This is like a very big issue. The gaps that we have inside our countries are important to highlight here. This could create a lot of barriers to people. And the second is when we decide, like, people who don't have a digital version of this certificate cannot get inside these places, because that's another big discussion that we're having. The problem here is when we are talking about spaces that are crucial to the exercise of our rights, meaning those are essential services, health services, education services, or going to public institutions, agencies or buildings, where you need to go to pay your taxes, or you need to go to request assistance from your governor and to your community, something like that. When they need to, and they ask you, require you to have this as a as a condition to access to those services, then we're getting a problem, because you need to go to access those essential services, and the need to have a COVID-19 digital certificate creates more problem, more barriers that we already have in this moment. So we need to see that even though we would like everyone, to be healthy, and we want this pandemic to be over, we'll need to see that there is entire situation happening internationally and locally, and we need to see this, looking the neighbor countries and how they are working towards fighting this pandemic.
Thank you very much, Vero. And I always find it concerning and somehow not so surprising in terms of how our governments in the region prioritize different agendas, where they rush to adopt technological solutions but forget or deprioritize the investment of infrastructure, ensuring that everybody has access to a stable and affordable and safe internet connection, and ensuring that everybody can enjoy being logged in online in this digital age. And this leads me to my second question to Ghinwa. I mean, as we said, tech solutionism, the idea that technology is always the best solution, has been the hallmark of the COVID-19 response, not only in our region, but also around the world. From the push for contact tracing apps to early attempts at digital immunity certificates, and of course, the discussion of today, the digital vaccine passports. As a person who works on public health measures, there's always this lingering question whether these technologies indeed, especially for the proponents of such technologies, do these technological solutions make public health responses, especially in the context of COVID-19, better or more efficient?
Yes, thank you for your question, Marwa, and thank you for the answers of Veronica, because it was very well elaborated. Technology is actually a double-edged sword, if we want to think of it this way. While it might be good in some contexts, and it might be supporting public health measures, it might be supporting keeping us all safe, keeping our health safe, protecting us, and so on, it does have a good part of being discriminative, again, against marginalized population, but also in a way of being intrusive into our, let's say, rights in terms of data privacy. And this is very much kind of it's pros and cons, if I want to say. So we have like two concepts that Veronica kind of also talked about it, like digital literacy. I mean, we have, so this is the first thing. I mean, having the contact tracing app, having our health communication channels being more towards social media rather than usual media, having the COVID-19 vaccine passport, the registration to get the vaccine being on our phones. So did these government ever think, for example, that elderly, marginalized population, migrant workers, refugees, displaced persons, and everyone else who maybe first language is not, for example, Arabic, if they live in our region, or whose first language is not English, perhaps if they live in Canada or the United States, did they think of them when they are designing these applications or these health communication channels? So this is the first one. And definitely we've seen this in our region, and I've experienced it firsthand, and I come from a privileged background compared to the vulnerable population I'm talking about and I'm referring to, is that I had to register almost my whole family who were above 50 to get their vaccination, because of, even if they have phones, but manipulating the vaccination application is not easy to them. So just, I mean, thinking about very much other people who really wouldn't have any knowledge about manipulating, I mean, or having access, or maybe finding the link to register and so on. So there was a lot of effort done by humanitarian organization, but again, it's not, we're not questioning it, but is it enough to get these people to get to the vaccine? This is like the first step to register to it. So there's this. And then second, there is also the poverty in acknowledging our privacy and data rights. It's also a two-way thing. So some people are very much aware of their data privacy rights, and they would go and answer and ask. So myself and probably a lot of other people did perhaps ask, for example, because I registered in Lebanon, did ask the Impact platform, how are you protecting my data? What is happening? Maybe they read the consent form that they were signing. But from another perspective, there's a lack of knowledge about these data privacy, and people who just maybe sign up to multiple platforms in our region that did not have the adequate measures to protect their privacies and their data. And then there's also another layer to this data poverty, where people that, for example, stateless, refugees again, people, undocumented people, would be afraid of going to register on such platforms, even if they are aware of it, because they don't trust, let's say, the government or the entities that are promoting this. And this is again an added layer to their situation. It's more endangering to them. And even though there might be a promotion that, okay, we're protecting your rights and so on, but again, this lack of trust is a very big gap. and amending it is not as easy as just telling people, your data is protected. And this is a problem that has been happening with a lot of refugees in our region and displaced persons and migrants. And this is why they have been a very low vaccination rate among these populations, despite the multiple efforts that were done by governments and by humanitarian organizations and so on to uptake, to increase the uptake of the vaccination. But these are problems that we should acknowledge and we should work on. And again, so the tech solution is also a barrier for borders, not even for accessibility to the vaccine. So having, Veronica also was talking about this. So going from country to the other for just any purpose, maybe it's for a life-saving purpose that you need to go for work or for, to see family and to see on. But the vaccination passport has been very much of a hurdle, especially that some countries, especially developed countries, have been asking for certain types of vaccination. So example, Europe are only taking people vaccinated with like Pfizer, AstraZeneca, and it's the kind of AstraZeneca that's made in Europe and not the one made in India, but they amended now this. They're not acknowledging people who have other types of vaccination. And this is, keeping sometimes families apart, keeping people from going to commitments related to work, because in their countries, in their region, they don't have access to the other vaccines, or they just simply don't have them. So again, an added hurdle or an added obstacle for many people, marginalized, vulnerable people, or not, even privileged people have these hurdles to do. So technology has, even if it might support us, might help us in such a context. We need to keep in mind when we're designing such solutions to have a very comprehensive and holistic approach, including everyone and being very inclusive, and also having an approach that is also targeted towards protecting people and protecting their data and their privacy.
Thank you, Ghinwa. Just to share a personal anecdote, when my husband and I decided to travel for the first time after we were vaccinated, I held on dearly to my written, COVID-19 passport, and he was like, "No, you should try the app. It's more convenient. It's more efficient." We traveled. On the way back, one day before our travel, his phone completely went shut down, and he didn't have access to the vaccine passport, which meant that he was not able to onboard to the flight. Just to show to what extent these claims that technologies make our lives easier is in fact not that true after all. It can get super complicated.
It does. If you can just allow me to add something. So last week I was visiting. I was abroad. I was in France actually, and I was visiting just a kind of a museum. So the person, they ask for your vaccination card there. So a French person, was showing it on a piece of paper, and they didn't have it on the phone. And actually, like, the detector was not detecting the QR code on the paper, and that was sad to see, because the person was like, "But I'm vaccinated." And the person on the security person's like, "Oh no, but I'm not detecting it. It's not valid." So again, how technology can fail us, and it can be discriminatory, even again for people that are able to get this vaccine. But there's many layers of these hurdles and obstacles that we should acknowledge at the end.
Yeah, indeed. And you also mentioned the risks pertaining to privacy and data protection, and I'm going to move it to Veronica to expand a bit more on that. So, digital vaccine passports, pretty much like contact tracing apps, they rely on the collection and processing of personal and sensitive data, like your name and date of birth, your health status. And so they do inherently carry out many risks, and especially in contexts where there are no robust data protection laws, as in the majority of MENA countries, and where the authorities cannot be trusted with handling and safeguarding this sensitive personal information. So can you expand a bit more on this point, Veronica, and illustrate what exactly these privacy and data protection risks are?
Sure. And before answering that question, just to add another layer to what you were discussing, the COVID-19 this apps and the QR codes. So there are also claims of people changing these QR codes to show that they are vaccinated. So sometimes we believe the technology will not fail. This is the truth there, and there is nothing wrong with it. But as it can happen, that they can people can change or adequate their documents, as we can say that, it can also happen digitally. So just that, to have that on mind as well, because there are different arguments right now and positions. But regarding to data protection, that's a very, very crucial issue. Just to have something in mind, at the beginning of this year, our office, Marwa and Dima at that point, published one report regarding contact tracing apps and data protection in the MENA region. And that's a very easy way to understand how the data protection framework is not as strong in the MENA region. So there is a lot of work to do there. There is a lot of work to do on legislation, on having judicial, or in this case administrative decisions that can create this idea that yes, we have a right to have our data and our privacy respected, guaranteed by the state and things like that. So to have that's a very like the background and the context that we are in, and thinking about a context. A COVID-19 passport, or however we can call it, creates another layer of problem there, because this, as it happened with the contact tracing apps or other COVID apps that were on with us for some time in the past, this apps collect a lot of information. They usually tend to collect a lot of information, and if there are no rules in place, they will collect more information. Let's be sincere there. And so this at least the idea of a data minimization principle, that we all know that we should just collect the data and use data and process data that are necessary for the purpose of something that we want to achieve, which is something, and it's a principle in data protection regulation, is not there. So we have seen this during the pandemic. We understand that it's normal to process personal data in the middle of a pandemic, because we need data, we need to process things, we need to have results, have ideas of what's going on with the country, inside the country, sorry. But there are limits, and one of the limits are this data protection principles, and the idea of minimization is something that it's not usually there. That's the first point. A second point regarding this is security of the data. So there's going to be this app QR code, which is going to lead us to a web page or something that will show. Usually it's a web page that contains information about our vaccination status, about where we got the vaccine, which vaccine, and our names, and blah 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 things. Maybe this information is connected to a centralized registry, and that's how the problem starts to get bigger and bigger and bigger, because sometimes these registries are centralized registries where all the information, everyone is there. And the problem to have everyone's information in just one place creates just, as people who work on cybersecurity might already know, it's just one place to attack, an easy way to get access to everything. And you will say, no, but our governments are taking care of our information, and they are putting a lot of measures and a lot of safeguards to protect the information. Yes, they can tell us that they are doing their best on this, but it's already a risk there. So they are taking the risk to create this COVID-19 vaccine certificates, but they are already creating the risk. And as I'm saying, that the problem is when they connect this to a bigger civil registry, is that because you are creating more information. So one person is in the registry with all their information, your name, your birth date, your parents' information, in another data depending on which country we're talking about. But now you're adding more information to that regarding their vaccination status. Having all this information for just in one place, as I'm saying, creates problem, but it also in countries where there are surveillance concerns, that also creates another point of problems, of concerns, because for a state or for a governor or for a person who wants to surveil people, having more information is like a reach moment of getting more and more and following more and more people and what they are doing and blah blah blah. So now you don't only know who this person is, where this person was born, or where they live, but now you know their vaccination status. And the problem with this COVID-19 vaccine certificates or passes or passports, as we call it, is that in some cases you're gonna be asked to scan the code, and maybe because we actually don't know which technology they are using, but maybe there's gonna be, after you scan this code, the system will kind of create like information saying that this person was scanned in this place or was scanned today at 7 a.m. in the morning. And you create a history of logs or a history of how many times you got scanned. So that depends on the technology. I'm just talking about something that could happen. And then you get like, okay, this person got scanned or got verified like 10 times today, and tomorrow was 2 times, and the following day 3 times, something like that. So you get also you can also trace someone movements using this COVID-19 pass. That's another issue. That also, as I'm saying, it depends on the technology, but again, it's another layer of information that we are providing to the government that maybe it's not necessary for the purpose of fighting this pandemic, to be honest, but also to creating more information for the ones who want to surveil the citizen or want to create a more surveillance state. So you have, and there are different layers that I'm saying, just trying to explain here, of risks that are happening. And as I said, the problem at the very, very big base is that we don't have a strong data protection frameworks in the country. So if these things that I'm explaining, these layers happen, there's not going to be way for us as citizens to say, to exercise our rights and say to the public authority, why you're doing this? I want to know where my data is stored, how you use the net, for how long are you going to be storing this data? This exercise of rights this exercise is very important for us, but we lack of this strong database data protection framework, and that at the end of the day creates more problems. So just bear in mind, when we download an application, bear in mind that when we want to have more technology for this pandemic, to bear in mind like where we are standing. So if our country does not have a data protection regulation or does not have a tradition, protecting our privacy, then we should think twice. That will be my biggest recommendation for everyone who is watching us today. We have other recommendations in our paper, but I think this is like the very easy one that we can take from this conversation.
Thank you, Vero. So speaking of recommendations, and I'm conscious of time that we have 10 minutes warning before our session ends. Just a reminder to the audience, if you have questions, please feel free to drop them in now, so we can manage to answer them in the next 9 minutes. Before we move to recommendations, actually, I would love to give the floor back to you, Vero and Ghinwa, to also think of solutions where we can go from here, not only during the pandemic, but also post the pandemic, because often one of the biggest warnings for all privacy advocates around the world is that we are establishing an infrastructure of surveillance that could be repurposed for political objectives after the pandemic. So I would love to hear from you, from each one of you, what we can do to ensure that these technologies do not get repurposed. What can we do to ensure that these technologies do not infringe on our fundamental rights? And particularly from Ghinwa, as a person who works on public health issues, what would be the best way for authorities to move forward? So maybe I will start with Ghinwa and then I will pass it to Vero.
Yes, thank you. I think in our context in the Arab region, the main recommendation I would give to everyone is just go out there, read about your data privacy rights, and acknowledge them, learn about them, and also to have these awareness sessions being a bit all around, because in the region mostly we lack infrastructure because we lack the knowledge. We lack the fact of holding accountable people in legislative positions and in government positions to protect us at the end of the day, to protect our data. We don't hold them accountable, or if we do, it's mostly on a level that's a bit let's say concentrated and small compared to more developed countries where you have a lot of rules that are a bit that gives us a headache, such as in Europe with the GDPR rules. That it's a bit it does give everyone a headache working in research or working with anything related to data. But again, it does give an assurance to people that's protecting their privacy. So I think a good place to start here is just really knowledge and awareness about this. And then bit by bit, we could build up to holding other people accountable, to asking about these data privacy rules and regulations and so on. And also acknowledging that we're never away from these breaches, even if we are assured that that we are being protected. And also, as a final recommendation, is to acknowledge as well that access to, going back a bit to our topic of vaccines, access to vaccine is not equitable among all. And so this is also a good lesson for all of us to try and support maybe other people we know for them to go get these vaccines, not the vaccine passport, but the vaccine, and to basically help protect them. So I think these will be my 2 cents for the session.
Thank you very much, Ghinwa. And if I may, I will add the question from the audience. It's an interesting one. Is it a fringe on rights to impose the vaccine passport on people who do not want to do the vaccine?
Yeah, that's a very interesting question, a good one. So I think what we need to think from this perspective is that the vaccine is a tool to protect us all and to protect our health and the health of the people around us. And from here, people should make the choice of getting it or not. So this is what it is. And I started the talk by saying that, you know, we have these vaccine scars since we are young, and these vaccine scars, we did not take the vaccine since we were like even 1 month old. It's just to protect us and to protect the people around us, protect our health. So this is it. Now we added this layer of the vaccine passport. That's an obstacle, but again, think of it on a lower level of the vaccine itself being a protection.
Thank you, Ghinwa. Indeed, if you have access to the vaccine, please get vaccinated. And for those who don't have access, I hope it will be rolled out soon. So in the last 5 minutes, I will move it to you, Vero, to also share recommendations from Access Now. I know that we've worked quite extensively on the issue of digital ID in general, but also in the COVID-19 passport. So over to you.
Yes, I'm gonna do a very big +1 to what Ghinwa has said, because those are like very, very important recommendations right now to get informed, to get acknowledged of what's going on. So that leads me to what we can ask our governments, because at the end of the day, we do have at least in paper, we do have the power to ask our governments about what they are doing in this pandemic. And things to ask to our governments are, first of all, transparency. This is a technology that is going to be there. Sometimes we don't understand how this works. It's not clear where the information is stored. It's not clear if they do have a privacy policy or what kind of rules they are using if there are no data protection rules in place. So what are the rules that the government is creating to protect our information? We need to have transparency on that. Asking for that will give us at least a very initial knowledge of how this is happening and if it's going to be efficient or not. Because sometimes technology, as we are saying since the beginning, is sometimes just a blurb that it's there on how it can, help us, but we need real facts in order to continue, in order to fight this pandemic. We need real facts. We don't need lies or ideas that do not have any substantive support, ideas that can support that. Also, and we making this this paper that we recommend all of you to read, that is about, we call it Protocol for Exclusion of why COVID-19 vaccine passport can threaten human rights. But we make several recommendations to governments, such as, just to name some of them, that to do what is really effective. As I'm saying, it's very important to have in place systems, technology that have been proved to be effective, not to do what is trending. We see everyone's doing, contact tracing app, so let's do a contact tracing app when we even don't know how our situation in the country is. It's similar to what's happening right now with this COVID vaccine certificates or passports or anything like that. And we also talk about data protection. We also talk here about another recommendation to be inclusive. Again, the idea of having accessibility to the vaccines is important, but also having accessibility to, if they want to have a COVID certificate, these COVID certificates, whether they are digitally or are in paper, there should be accessible in a inclusive way. So because sometimes, and this is very sad to mention, but sometimes governments can think that we're gonna charge someone if you lose your passport, you lose your COVID certificate, we're gonna charge you in order to get a new one, and that can happen whether it's in paper or it's digitally. So again, let's be inclusive or understand the entire situation and how our population lives and their needs and what they want and how we can better address their situations. Also, we talk about something that Marwa also mentioned just minutes ago regarding how we can prevent their abuse in the future. There should be sunset clauses that can state very clear that after this pandemic ends, this information that we are collecting about our population should be erased, or should be just not be there for other, or not be used for other purposes. And this is something that we can also ask our governments. There are other recommendations in the paper that I invite you to check and to read, and also again to ask our governments, because we do have that at least that power. We have social media, we have different ways to express what we believe. But the first thing that I will ask is more transparency. These COVID passports are there, and we need to know exactly how they are operating and why they are there. So I will finish with that. And really, we're very happy for this conversation that is taking place. Yeah.
Thank you so much, Vero. And we come to the end of our session. I added a link to the Access Now policy report on digital vaccination passports. Thank you so much again, Ghinwa and Vero, for sharing your time and expertise with us. And thank you for everybody who joined us. I wish you a successful rest of the day at Bread and Net, and take care, everybody.
Thank you. Bye.